Okay, so borderline personality disorder is characterised in particular by emotional dysregulation. So the person themselves might experience very intense emotion compared to other people, very quick for that emotional response to happen, and very slow to recover from the emotion that they experience. They might also have fears of abandonment, so either real or perceived, which makes relationships difficult for them, as well as the emotional component to that. They may experience a lot of self-harm urges and self-harm to manage how they're feeling. They may experience dissociation. They might find that they do things more impulsively than other people, and that might result in difficulties for them later on. They might find that anger is particularly difficult emotion to manage, and that in itself creating difficulties in relationships and their everyday life. Yes, people can and do recover from BPD. We're very lucky. We have several researched evidence-based treatments that have shown some great results and found people going from a life that's very difficult to live and with a lot of suffering to, I guess, a more happier and fulfilling life. One of the main barriers to treatment would be stigma. Borderline personality disorder has a lot of myths and misnomers about the condition. People are scared because they don't know how to treat. They don't know how to be effective and helpful to people with the condition. Diagnosis is also a problem. It's very hard to get a diagnosis quickly. It sometimes takes some time for that to become apparent. And also too, people might have other difficulties on top of that. So they might have anxiety or depression or an eating disorder. So that can get in the way of effective treatment if there are other difficulties on top of that. And also, I guess, a lack of information. People seem to know a lot about depression and anxiety, but in terms of borderline personality disorder, that's still not very well known about, read about, and understood. Well, firstly, I think the best start would be to go and find out about the different therapies yourself. Go and do some reading. We're very lucky. There's lots of organisations and websites that provide good information about those treatments. Find what might work for you, what looks appealing for you, and then go and look for some mental health professionals and interview them. Ask them, what's their expertise in this area? Is there a particular therapy that they like to use or would choose to use, and why they do that? You'd also might like to ask a mental health professional if they would be willing to work with your family and with other people who might be on your caring team. So that might be a doctor or another professional that's helping